if you were to give just one piece of advice to an African American teenager, like 10 to 18, 20, or maybe like just starting college, about how to know if medicine is right for them, and how to know, and then if it is right for them, what they should follow up on to confirm that belief, and what would you recommend to that person?
Yeah, that's a really beautiful question. I think, my advice is, very high level, which is, whether someone really wants to become a doctor or not is actually, to some level, is a personal decision. It's not the society doesn't say you have to become a doctor. It's a personal decision. So how do we make personal decisions? Just be open to possibilities, because one of the most common problems with young people of any demographic is they close doors too early, so they're not open to possibilities. So if you really have the mentality that I'm open to possibilities, and that includes becoming a physician, you will be surprised by what you may encounter. The second piece of advice I often give young people is, once you make the decision that this is something you want to consider, take initiative, because things don't come to you. You have to seek them. You have to sort of ask questions. You have to, so the combination of being open to life and possibilities, and not closing doors too early in your career, and having a sort of initiative-minded sort of act before before anything else. Those are really the two big things that I find are instrumental in getting people to where they need to be. Where you have to go, that's a really sort of more of a personal question. But if you are open to possibilities, you will be surprised. You will eventually find your way to what you want to do. That's how life works.
Yeah. That's an amazing answer.
The struggle to really diversify our scientific community and the medical community is a really national struggle, and it's also a lifelong struggle. It's not something we're going to win overnight. It has to, and what's important to also know is that everybody has a role. We don't all have to do the same thing. Everyone has a role. So Michael's sort of reaching out to young people and telling him about his experience as a medical student is just as important as me at this stage in my career, trying to sort of talk to somebody to join us and be a professor at, it's my role is no more important than what Michael is doing. And so that's really one of the things that I try to tell people, is that no matter how small your act is or your intervention, it's just needed.